Welcome back. Time now for our Mental Health Thursday segment. And as we turn our calendars to May, it just so happens to also be Mental Health Awareness Month. So tonight, we're highlighting a local resource that's been around since 2012 called the Center for Positive Change.
So the nonprofit offers in-person and telehealth appointments, and the organization is accepting new clients right now as well. So to talk more about this is Executive Clinical Director Stephen Bright, who has joined us on the couch here at 4:30. We appreciate you, Stephen. Thank you for being here.
Thank you for having me.
And let's talk about the Center for Positive Change. For those who don't know, what's the mission, simply put?
Basically, we are a nonprofit organization in South Bend, there for people that are experiencing trauma, stressors, difficulties in their life experiencing, and giving them an opportunity to seek services to help them out. At the center, we provide individual and family therapy.
Wow.
We provide substance use treatment, domestic violence, which is on the uprise nowadays, which is unfortunate.
You've seen that here at a local level?
Oh yeah, it's increasing continuously.
Wow.
And we do some parenting support and also a batterers intervention program over at St. Vincent's de Paul. So.
You work with a lot of partners here to help people.
Yeah.
Oh yeah. It's all about community and collaboration, whether it be other organizations, whether it's the school corporations, whether it's a collaboration with Department of Children's Services,
Wow.
and even the probation department and the judicial system. We know that that's what's necessary in order to promote a healthy environment and strengthen people.
Yeah, I love that you offer so many different programs because it hits home for so many people. Also love that you offer telehealth appointments still, because that was big during the pandemic, right?
Yeah, oh, more than you even know.
Wow.
The unfortunate thing is as insurance companies have come back from the pandemic, some of those insurance companies are pulling back because they know that coming into an office, into this space where it's a safe, secure environment, a warm, inviting environment, is a better source of treatment than being on face-to-face versus on a phone or in the computer. It's better than nothing, of course, and that's what we utilize, but we always would prefer having them in our offices.
It might even help people. Sometimes they get intimidated. I don't need to speak with someone. That's for people far beyond me. Maybe that can help people reach that first step, right?
That is absolutely the truth. Yeah, when they can engage with the person and start to formulate that bond, that rapport that is absolutely critical in any type of therapeutic relationship, then they start to understand who that person is that they're meeting with, and then they feel more comfortable to make that journey to us. But it is important. I mean, we do have people that are doing all online types of intervention, telehealth, because there are people from a surrounding county that can't make it in.
True.
I mean, they just don't have the transportation, they have work conflicts, and we try to meet that need.
You mentioned people. I want to read something here. I think this is very important about the program. It says, quote, "The staff were very friendly and helpful. The class was most definitely an asset for my mental health, fatherhood, and lifestyle." Talk about what it does to your team to hear that and to tap into the person, not just on a mental health basis, but the entire person.
We love it. I mean, it's great and gratifying to see and to hear that people that are coming through our doors are actually experiencing the help that they need. They're feeling more comfortable and safe with themselves. They're feeling a level of respect. They're feeling value in themselves and knowing that they can tackle the many strategy or stressors that they have in their life. And so that's very, very gratifying. It's it's tapping into that person on an unconditional, positive regard basis, accepting them where they're at, letting them know that when they walk through our door, from the time in which they make the first phone call, walking through our door to experiencing our staff, that they are going to be accepted no matter what.
That's great.
And
to have that comfort, I can imagine it's tantamount. Especially.
It's incredible.
We have to wrap, unfortunately, but really quick, how can people enroll or even donate?
It's very easy to enroll. All you have to do is call our number at 574-360-4066. You'll be connected with one of our office managers. They will get you through the process, or you could even go online to our website. We make it very, very easy. And on our website, you can even find the place in which you might want to donate. We certainly welcome anything that people could provide.
Yeah.
And so I appreciate both of you having me on and being able to share what we do, because it's all about every one of us, not just Center for Positive Change, but all of us working together, mental health facilities across the state and community. So I appreciate it.
Stephen Bright providing a bright spot for us here today. Really quickly, we always want to do this. 988, that is a suicide and crisis lifeline, by the way. If you have any trouble or know someone who's going through troubles right now, especially when it comes to their own lives, that is the number to call 24/7. You can call, text, or chat as well. Stephen, thank you for joining us.
Thank you. I appreciate it.
And of course, we appreciate you. Hello,